Today we'll be talking about ulcerative colitis and inflammatory bowel disease. So with this, it creates ulcerations in the innermost lining of the colon, which could lead to scarring. So that's very difficult, very painful, very debilitating for these patients, and could lead to very life-threatening complications. And whenever we talk about this, we need to think that it doesn't develop suddenly, but it develops over time, despite the exacerbation of symptoms, if that makes sense. So there are like 4 different kinds of ulcerative colitis. So the first one is ulcerative proctitis. This one is really just localized to the rectum, from the rectum to the anus. So really the only signs and symptoms that we would see with this one is rectal bleeding. And then we would move on to proctosigmoiditis. This one is inflammation that involves the rectum and the sigmoid colon. So that's really just from the rectum to the end of the colon. So these signs and symptoms would include diarrhea, cramping, pain of the abdomen, and the inability to move bowels despite the need to do so. And then we move on to left-sided colitis. So with this one, it would reach all the way from basically the anus or rectum to all the way through the sigmoid colon and up into the descending colon. So that's quite a bit, and it's all the way up your left side, so there would be a lot of left-sided pain, hence the name left-sided colitis. There would be the urgency to defecate, so these patients are going to have a hard time getting to the bathroom in time, especially with their pain. So, and then patients with pancolitis, this usually affects the entire colon, which I can't imagine. They'll have severe bloody diarrhea, abdominal cramps, pain, fatigue, and significant weight loss. So with these patients, we're gonna need to be watching their nutrition, things like that. So it'll be very difficult for them. The etiology. So the cause of this is really idiopathic, but there are a lot of factors that a couple of factors that seem to play a role in the development. It is autoimmune, so I don't know. So they think that it could be hereditary, but a lot of times they think that when patients develop this, it's because they've had a virus or a bacterial infection in their colon, and their body produces this abnormal immune response in which it starts attacking the inner lining of the colon. And they used to think that foods would cause the development of ulcerative colitis, and that's not true. There are only foods that aggravate it. So clinical manifestations. There are often periods of remission and exacerbation, as I said. Patients with severe ulcerative colitis can have as many as 15 to 20 liquid stools a day, containing blood, mucus, and pus, which causes a severe loss of sodium, potassium, bicarbonate, and calcium, which we'll talk about in the next slide, the complications that can really occur from severe ulcerative colitis. The urge to defecate lessens as the scarring continues to progress. So they're going to have a difficult time controlling when they have to go. So we're going to need to listen to them about their